and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency, and we're servicing Palm Beach County, Broward, and Miami-Dade. You can reach us directly at 954-717-7027. I am your host, Louise Gomez, and I am excited to introduce today at our guest is Dr. Payaal Patel, and she is a neurologist and principal investigator. And the name of the organization is Brain Matters Research, right here in Delray Beach. And the phone number is 561-374-8461. And the address is 800 Northwest 17th Avenue, Delray Beach, Florida, 33445. You can reach her at the email address is info@brainmattersresearch.com. Also, the website, www.brainmattersresearch.com. Also has a location in Stuart. Brain Matters Research is on 900 Southeast Salerno Road, Stuart, Florida, 34997. And you can reach her directly at 772-223-7880. Thank you for coming to the show, Dr. Patel.
Oh, you're welcome. Thank you so much for having me here tonight.
You have such an impressive resume. I didn't want to leave anything out. I think it's best that we get it straight from the horse's mouth, and as they say, and we'll just get all the information from you. One of my favorite topics is brain and brain health. So I am so fascinated with the brain and all that it does. So we'll definitely get deeper into that. But if you can just share with us a little bit more, if you can share with our listeners and viewers a little bit more about your background, experience, education, and training, and where you started out.
Sure, absolutely. So I am a neurologist by trade. I went to the Ross University School of Medicine and did the majority of my training clinical-wise up in Chicago, and then later residency-wise in Peoria, Illinois, at the University of Illinois, Chicago. I completed my training with a fellowship in memory disorders, specifically at Northwestern University, where I was lucky enough to have a mentor who actually is the gentleman who coined the term primary progressive aphasia. One of the rarer dementias out there, which starts with predominant language difficulties. And then I decided to move away from cold weather and move down to Florida until I realized that winter down here gets kind of chilly too.
Thank you for that. We appreciate you coming down here because it's so needed with our demographic. And
Absolutely.
yeah, it's really so needed. What's the age range of the patients that you see coming into the clinic?
So we see patients anywhere from 55 years old to sometimes mid to late 90s. We specialize in clinical trials, which we'll get into, I think, a little bit later on.
Yeah.
Most of our trials and participation involves patients from 55 to 90. But we do from time to time evaluate patients who are just below or just above that age range too, just as part of our complementary memory evaluations.
I like that. So as a complementary memory evaluation, does that also give you guys data as far as, I don't know, because you do research. How does that work?
Yes. Absolutely. So we have a program called the No in 90 program, and basically broken down, the No in 90 program is a free complimentary assessment where any senior who is concerned about their memory and thinking, who is at least open to the idea of treatment through research, can come in and provide an intake to a trained staff member. That trained staff member then shares that information with myself or our other physician on site. And then we go through all the information available and we decide whether, we decide what the best diagnostic and treatment options are, whether that's through research or whether that's through an outside facility. We have neurologists that we work with closely in the community, and sometimes we realize that research is not for an individual, and we decide to go that route in terms of referring for an outpatient workup. I think it's a good start for any senior who is concerned about their memory and thinking. And just to share an interesting statistic with you,
Please
I
do.
recently found this out. Yeah, so there about 83% of seniors are concerned about their cognition or memory in terms of changes. And this is a whopping number. Only 16% actually do something about it and go in to have that evaluated. And it's kind of crazy because the brain is the largest organ, most important organ in your body to some extent.
Yes.
And people are clearly concerned about it. But there's, you may say, well, what accounts for the discrepancy there? And I think a lot of things. I think the social stigmas, embarrassment, I think denial, which can be part of the disease itself in terms of not recognizing the changes.
Fear.
Lots of things. But
Fear.
fear,
Like, what am I
anxiety.
going to hear? What are they going to tell me, right?
Yeah, and I think it's really important to know that if you have a change, not all changes are Alzheimer's, and there are some fixable, treatable causes. And you're not going to find that out until you go in and you take the first step and get that evaluated.
Yeah, I mean, I'll speak for myself. As I age, sometimes I get like brain fog, or what was I doing, or where did I put my keys, or and makes me think like, okay, is this the natural progression of aging, or is this hormonal, as they sometimes say? Like, there's so many different factors, and really the only way people are going to know is if they go see you, right? And they do an evaluation.
Absolutely, absolutely. And I think one of the common questions is normal aging versus mild cognitive impairment. When do I know if there's a problem? Like, when should I even know to come in for an evaluation? And the simple answer is, if you're concerned, at least come in and have a baseline evaluation. If nothing else, if things change later on, at least you have something to compare to.
That's exactly what I was going to say. Wouldn't it be great if everybody had a baseline, where we can say, okay, I'm 50 or 55, let's get a baseline evaluation. And then from there, we can see how we progress.
Yep.
I feel like that would be vital to so many people that are, concerned about their health. So does somebody need an appointment to go get an evaluation? How does that work?
Yeah, so it's really easy. And I think we'll reiterate the phone number again, but basically just give that number a call and let them know that you're interested in setting up a free memory screen. At that point, a staff member will take a basic phone intake that just involves some basic demographics, some basic medical information, and just determine whether, evaluation at our site is the right option for you, just in a very basic sense. And at that point, you'd be scheduled to come in. Usually you're able to get in within a week or two.
Nice.
Yeah, which is a pretty good turnaround time, especially because it can take months to see a neurologist in this area.
Yes,
in
this
general.
is true. So are you accepting insurance, Medicare? Also, your organization accepts that type of insurance, private and
Well,
Medicare?
so here's the best part. Everything that we do is at no cost to the patient. And so you might say, well, what's the catch there? Because everything that sounds too good to be true seems like it has a catch. Our focus is Alzheimer's clinical research. And so we are one of the largest private research centers out there, and our focus is specifically Alzheimer's. But in the process of determining eligibility for studies, we often find other things and make other recommendations. But our clinical studies are sponsored by pharmaceutical companies, and they pay
Nice.
for the diagnostic workup that goes into determining eligibility and pay for the treatment as well,
Wow,
which
this
is
is
awesome.
amazing. Yes.
Yes.
So something I've always kind of trying to decipher, if you can explain, what is the difference between dementia and Alzheimer's? Is there a difference? And if so, what would that be? What does that look like?
Yeah, that's a great question, and it's actually a very common question, so I'm glad you asked
Yeah,
it.
good.
It's probably the most common question that I get asked anywhere. So the easiest way to think of it is dementia is an umbrella. And underneath that umbrella fall different types of dementia. And the most common type of dementia, specifically in the age group above 65, is Alzheimer's dementia. And then after that, there's a debate as to whether second and third are vascular dementia and Lewy body dementia, which is a combination of cognitive deficits and Parkinson-like presentation. But the simplest way to think of it is Alzheimer's is the most common type of dementia, specifically in that age group over the age of 65.
Is it more prevalent in women than men, or is it kind of 50-50, or do you have any data on that?
Yeah, I don't know exactly what the statistics are, but I do know that it's generally that gender is a risk factor and being a female is a risk factor. So we
I
do have more females in general.
Interesting.
Yeah, and then on the topic of risk factors, age, just as you get older, the risk increases exponentially above 65. Then you also have other risk factors as far as educational level, vascular risk factors, ApoE status, which is a genetic risk factor, all kinds of other things too.
You know, I was listening to a doctor on YouTube. I can't remember the name, but I believe he was mentioning one of the studies they've done in research is green areas. How close are we out to nature? Green areas, parks,
Oh,
nature. I thought that was interesting. How being closer to nature, and they kind of traced it back to where we lived when, where did you live when you were younger, and I think from what I gathered, I believe people who lived in more of the, green area had less incidents. I thought that was interesting. As far as risk factors.
yeah, I hadn't heard about that study, but my guess would be that it might be tied to just state of mindfulness, stress level,
Makes
risk
sense.
factors from that standpoint, because depression, anxiety, untreated, stress, they're all risk factors for Alzheimer's as well.
Oh, they are. I was going to ask you that. So
Yep,
I was just going to ask you one of those questions. If people who have depression and anxiety, they're at higher risk to have this type of, they are.
absolutely, especially if untreated.
Yeah, it makes
Sleep,
sense. So do
sleep
you,
disorders like sleep apnea also
oh,
increase risk. Yeah.
oh, that's true too. I wasn't even thinking that. So anything that's kind of going to disrupt our peace it sounds like is going to have a risk factor playing into that, huh?
Yeah, that's definitely a common tying factor. But then also with sleep apnea, you also have reduction in amyloid clearance in the brain. These amyloid plaques that are part of the hallmark physiology involved with Alzheimer's.
Oh.
So physiologically, when you're having sleep apnea and it's untreated, you're actually clearing less of that plaque, and it's accumulating. And of course, the theory is that that plaque is triggering off other inflammatory reactions in the brain and so forth, but that it's essentially toxic.
Now that you bring that up, I'm remembering. So can you share how does that amyloid plaque build up? Is there, I mean, I've heard people say maybe metals, exposure to toxins. I'm not sure. Actually, we're going to take a quick commercial break, but when we come back, let's talk about the amyloid plaque and how we can help, if we can help prevent it. We'll be right back with a quick commercial break.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thanks for tuning back in. We have Dr. Patel, who is a neurologist and principal investigator right here at the Brain Matters Research in Delray Beach. You're going to want to go in. It's free screenings. Her number is 561-374-8461. You can also see the website, brainmattersresearch.com. It's right here at 800 Northwest 17th Avenue, Delray Beach, Florida, 33445. Also, if you're in Stuart, Florida, the address is 900 Southeast Salerno Road, Stuart, Florida, 34997. You can also call the Brain Matters Research in Stuart at 772-223-7880. So, Dr. Patel, that's a huge topic that I'm layman's terms. People like us who start hearing things like, okay, amyloid plaque, and right away I'm thinking, oh, is it like the plaque in our teeth we can take care of and we can kind of maintain it by eating healthy, brushing our teeth, going to the dentist? Is there anything we can do to prevent amyloid plaque, and what is amyloid plaque?
So the amyloid plaque is made of an abnormal version of a natural protein in the brain called amyloid. So it's a misfolding of a protein, and then it causes these accumulations. And it's easy, in layman's terms, I think the easiest way to think of it is these plaques are almost like sticky substances, like cotton candy, and they form between the connections in the brain at the synapses. So you've got neurons that are communicating with each other through these branches called dendrites, forming these neuronal connections, synapse points. And when this cotton candy-like plaque deposits itself there, you're keeping these neurons from communicating effectively with one another. And the information that they're communicating is regulating memory and thinking. So eventually, when neurons can't communicate each other effectively, they die. And that's where you start to get the atrophy, the shrinkage in the brain because of the loss of the brain cells and neurons.
Wow.
It's not something that you can necessarily impact per se. I shouldn't say that. It's not something that you can prevent from forming completely per se, but there are things that we think can reduce its deposition. I think there's definitely an inflammatory component. And so, we think that things like exercise can help reduce risk and help the process from propagating, because eventually when you get enough amyloid plaque deposition, you also get tau tangle formation. And
What
that's
is
another.
that? That sounds even
That's
worse.
another
Oh, what is
approach.
tau tangle?
Yeah, so these tangles form inside the brain cells, inside the neurons, and they basically they travel on these microtubules, which are like train tracks within the neurons, and eventually they travel to the outside edges of the cell, and they blow a hole in the membrane, and they travel and they jump from neuron to neuron, and that's actually how we think the disease spreads itself. The plaque
Interesting.
stays in one place, but the tau tangles actually travel. T for travel.
Wow, interesting. Now you said something to me that it rang true to me when you said inflammation. So reducing risks of inflammation, is that maybe a way? You mentioned possibly exercise. I'm just trying to see, like, how can we as regular people, regular consumers out here wanting to figure out what can we do in our daily life to possibly reduce this risk, reduce inflammation? Is there any type of exercise protocol? Do you recommend walking, or what do you recommend for
Yep.
to patients?
Yeah, that's a really good question. I mean, there's all kinds of data out there. I know that the data that I've looked at more recently indicates that it's kind of in line with the American Heart Association, which recommends 150 minutes. Actually, I think it's 130 minutes of cardio exercise a week, and that's exercise that gets your heart rate up. But when I tell patients that and I say, well, you've got to exercise 5 days a week, 30 minutes, they look at me and they're like, that's a lot. How do you want me to do
Really?
that? Yeah, it's interesting. Like seniors are, I think it's a daunting task. And
Mm,
so I never suggest it like that. I say, look, this is the recommendation, but I think that in order to be efficient at something, in order to build a good habit, I think science says that it takes about 30 days.
yeah.
Start somewhere. Start with a simple goal. Start with 2 times a week, 30 minutes, and do it consistently. And I think when you realize that it makes you feel good, you're going to want to do it more naturally, but don't start with that target goal right off the bat. I don't think that that's necessarily sustainable. And then the other evidence suggests not only doing aerobic exercise, but also strengthening exercises with either resistance bands or weight machines twice a week, 2 to 3 times a week, and then also gait balance training at least once or twice a week as well.
Balance training. I've heard that actually.
Yeah, and that could be pool exercises. It could be exercises that, that you're given from a physical therapist or a trainer. But, kind of a multi-dimensional exercise program is really thought to be helpful. Now, with the cardio exercise specifically, evidence seems to suggest that even with 1 year of aerobic exercise, that there is reduced shrinkage in the memory center of the brain, the hippocampus. And
Wow.
so,
That's good
Yep, so
news.
there's yep, so there's strong evidence there. And then obviously exercise helps your mood, helps your stress level, which we think also is a risk factor for Alzheimer's.
Absolutely. I know I'm a walker. I've been doing it for years. And for me, it's really, I just do it for the reduction in stress and just to feel better. But knowing that it has these other good side effects, encourages me to want to continue to do that and do it more. So, I guess what you're saying is just to create the habit. And I like how you're saying, take small steps in the beginning,
Yeah,
create the habit. That's the most important thing, right?
yep.
Now, what about diet? Is there anything that would suggest, because I know they link sugar to inflammation, is there anything that you would recommend as far as a diet, or is there any type of foods that you recommend, or what do you suggest to the patients?
Yeah, so the Mediterranean diet is the most commonly recommended. So when we're looking at Mediterranean diet, we're looking at lean meats, staying away from fried foods. We're looking at fish, turkey, baked chicken, not fried chicken, those types of things, and then green leafy vegetables. And darker fruits, berries that are higher in antioxidants, grapes. There's been some good evidence behind grapes as far as their anti-inflammatory and antioxidative effects on the brain. Um, and then good hydration. Just sticking to foods really that are antioxidant and anti-inflammatory in nature, and staying away from those refined sugars.
Yeah, definitely. We have 3 minutes left, Dr. Patel. If you can just kind of, I don't know if you want to share maybe a story of maybe a patient who had some good results or whatever you'd like to share, please do in the last 3 minutes that we have.
Sure, no problem. Yeah, I think really when we get to this part of the program, I usually just like to share some key takeaway points. And I think, we go back to that astounding statistic. 83% of seniors are concerned about memory and thinking, but they're not doing anything about it. And it's kind of sad because we've got regular maintenance workup for all kinds of other things. We get invasive procedures like colonoscopies, we get breast exams,
True.
mammograms, the whole gamut of things. And here we are neglecting the brain, and all that it involves is answering some questions about how you're doing in everyday life and taking a short memory test, which can take 10 minutes. You don't have to spend the whole 90 minutes that we provide for a complimentary evaluation, but I think taking that first step and getting into, to see a provider, and whether you do research or not, it's not a problem. Just getting in there and having a baseline and having some direction in terms of which, where to proceed. Because sometimes what you think might be a memory change might just be normal aging. So you might
Right.
actually get some reassurance out of that evaluation.
That's
But
true.
I think, the key point that I could give is early intervention is the most important thing. I forgot to mention that we also do prevention studies as well.
Nice.
And science is really indicating that the earlier the intervention, the better the prognosis. So, I just don't be scared. Come in and, defining what you're experiencing in everyday life with the diagnosis only helps you and can really help keep you functioning independent for a longer period of time.
Thank you so much, Dr. Patel. I want everybody to give her a call. Her number is 561-374-8461. Thank you so much. It was such a pleasure meeting you, and we'll see you
Same
soon.
here.
Take care.
Thank you so
Bye-bye.
much.
Absolutely.